This is Chapter 19, Epistaxis. Epistaxis is another word for nosebleed. So it's a very common occurrence. They say that over 60% of people will experience a nosebleed in their lifetime. Usually these are very minor, but they can be life-threatening. The causes, etiologies, and you need to remember this is the biggest cause is usually digital manipulation. In other words, picking your nose. So instead of saying that, we're going to use scientific words of digital manipulation. It's most common, of course, in children, or hopefully, and more frequent in males. So 80% of nosebleeds, they say, are idiopathic. Something that is idiopathic is like it has no known cause. They don't know why. So more common in fall and winter when it's dry outside and you have cold weather. 85% of nosebleeds known as anterior bleeds and are really easy to manage. So anterior nosebleeds occur at Kieselbach's plexus, or another name around that area is called Little's area. It could go on a test question as either one. And it's a group of arteries located anterior to the septal wall, close to the mucosal surface. And so they're broken very easily. And it's pretty easy to manage a nosebleed that's coming from the anterior part of your nose. Posterior bleeds are common in the geriatric population. Older people tend to have nosebleeds for various reasons. Sometimes medications that are thinning blood vessels, and their skin is thinning out anyway, and so blood vessels can be very close to the surface of the skin and easier to break those and have a nosebleed. But if it happens in the posterior section of the nose, which geriatrics are more prone to, it can be really difficult to manage. So these posterior bleeds occur at a place called Woodruff's plexus, and so that's in the posterior part of the nose. Arteries are located superficially, very close to the skin, in the top of the skin, in other words, and damage really easily. So what you need to know on here is we're going to be talking about Kieselbach's plexus and Woodruff's plexus. So Kieselbach's plexus right here, and that's of course all of the anterior, and Woodruff's plexus right here is in the posterior section of the nose. And so children are mainly in Kieselbach's with picking their nose, etc. And geriatrics usually can have a nosebleed from the posterior part of the nose, and these are can range from no big deal to a big deal. So these Kieselbach's plexus, when you have a nosebleed at the anterior, it's pretty easy to manage. So how I remember this on a test, I can always pick out these names and know that these particular names have to do with the nose and the nasal bleeding. So I just remember that K is before a W in the alphabet. So when I see Kieselbach's, I know that's anterior, and Woodruff's, I know that's posterior. So you may be able to kind of memorize it that way. It's not like we're going to use these words a lot in our vocabulary, so you're likely to lose it. So just try to remember it that way. Local epistaxis etiologies. So the causes of nosebleed could be allergies, cocaine use, environmental irritants, foreign bodies. You can get something caught up there in your nose. I know my nephew, when he was This is many, many years ago. My nephew was 2, and I had just flown in to Kansas City. I was living in Dallas, and my sister picked me up at the airport. We rushed to her house. She had 3 kids, young. They were all young, and we were gabbing away, and the youngest was sitting in a high chair, and we had put his food on his plate, and he loved peas, and Joanna and I started gabbing away and turned around at one point and looked at Trevor, and he was just sticking, like, I don't know, he put like, I don't know, 6 or 7 peas up his nose. And then he couldn't breathe, and then he started crying, and we couldn't believe it. So that would be considered a foreign body. And yes, throughout the whole thing, his nose did start to bleed, and we did get all the peas out of his nose. So another one could be nasal sprays. They can irritate the nose and the tissues of the up in the nose. Neoplasms. Neo stands for something that's new, and so a plasm could be like a growth or a plaque or something. So a new growth in the nose, it could be because could possibly cause a nosebleed, and of course our old digital manipulation here. So other causes: septal deviation or perforation of the septus. That separates the right nasal cavity from the left nasal cavity. You have your septum. And so if you have septal deviation where it's not quite straight, it could be more to one side than the other, or curved, could create an issue. Or if there's a perforation, which means a little hole or something that is in the septal wall. Sinusitis, of course, any kind of trauma, upper respiratory infection, and sneezing a lot and really hard could possibly cause a nosebleed. So anemia, anticoagulants, which are blood thinners, aspirin, NSAIDs, warfarin, some herbal supplements can have an anticoagulant effect and make easy nosebleeds. Ginkgo, garlic, ginseng, or some other herbal supplements, the ginkgo and the ginseng, that could possibly cause this. Arteriosclerosis, hardening of the arteries, could cause a bloody nose. Any blood dyscrasia, that refers to any blood disease or disorder, such as hemophilia or a hemorrhage of any kind. COPD and a large alcohol consumption. Hypertension, high blood pressure, 3 times more likely to have a nosebleed if you have super high blood pressure. The blood pressure will rise again during the nosebleed, but probably due to the stress of the situation more so than the nose actually bleeding. So signs and symptoms, I always find this funny, as if you'd need to have to list a symptom or a sign of a nosebleed. Of course, it would be blood exuding from the nasal cavity. So they're different colors depending upon where they come from, which is a great clue for us. If it's an anterior nosebleed, it can ooze and bright red. If it's a posterior, it can be profuse, can be a lot, and really darker red. So it tends to drain into the oral cavity and can cause gagging or coughing, and they maybe even vomit up some blood. So treatment of a bloody nose. First, you're going to identify the mechanism of injury, how they were injured, and define the severity of the situation, and that's going to determine your course of action. You're always going to want to wear PPE, even before this COVID thing came out, because you were around another person's blood. So you want to ensure circulation, airway, and breathing, obviously, first. and you will suction the oral cavity if they're having a nosebleed in your office. Suction the oral cavity if necessary, and you want to position the head, you want to position them upright and their head tilted forward. And this was exactly opposite of the way that moms used to take care of bloody noses when I was a child. I had 3 brothers and liked to wrestle and whatever, so they had their share of bloody noses. But I remember Mom and other mothers of that era always tilting the head back. And that is not the proper way to do it. You want to position the patient upright and tilt the head forward. So you're going to apply direct pressure by pinching the lower part of the nose for 15 to 20 minutes. Have the patient breathe through their mouth while you're doing this, and have a place for them, a basin or something available. Apply an ice pack over the bridge of the nose, and patients should not blow their nose. The first thing that you want to do when your nose is packed and you can feel it packed with things is blow the nose. So you want to try to get them not to do that. If the bleeding does not stop after pressure is applied to the lower part of the nose and you've had an ice pack over the bridge of the nose for over 20 minutes, you need to refer them to an EMS. So what they may do is cauterize, or they may pack the nasal cavity if necessary. Lab tests may be performed to determine what the cause of that may be. They may have had such a bloody nose that they need a blood transfusion, and may need ENT, which is ear, nose, and throat doctor, to help with that. So my older sister, when she was, I don't know, like 5-ish, 6-ish, or whatever, they had rheumatic fever. And with rheumatic fever, she got bloody noses like all the time. She could, I mean, almost do nothing with her head, and it would cause a bloody nose. And so she was bleeding so much that that couldn't be stopped. And I know my mom said that they were just getting ready to go to the hospital, and all of a sudden it kind of cleared up and stopped. But the doctor later had said that if they're bleeding that much and longer than 20 minutes and you can't get it to stop and it's pretty profuse, of course they may need a blood transfusion, especially when it's a child. Instruct the patient to keep their head elevated for 4 hours afterwards to prevent a reoccurrence. So you don't want them to blow their nose for several hours. That could start bleeding up again. Avoid heavy lifting and bending at the waist for a good 24 hours. And also a good thing to use in your room is a humidifier to prevent dryness. So the prevention of epistaxis, you can apply a pea-sized amount of lubricating cream to the nostrils 1 to 3 times per day. Increase your water intake and try to avoid taking aspirin for a few days until this clears up. Didn't know there was so much to having a bloody nose, did you? Anyway, this will conclude this chapter.